Hello, I'm Glenn W. Hunter, and with me is Dr. James George of Excel Physical Therapy and Wellness. And today, what we're going to talk about is vertigo. There's a lot of misconceptions concerning vertigo, and what we have is Dr. James George here, and he's going to be able to share some insight. Dr. George, you get to deal with a lot of patients, you get to look at a lot of different issues. What is so special about vertigo for you?
See, vertigo is dissonance-like symptoms when we have issues with the gaze instability. Gaze instability, you're not able to focus your vision on something you're looking at, and this causes people to have loss of balance and dissonance-like symptoms.
So again, you have some things that are imbalanced, and all of obviously that's not something that we want to have as people as we're focusing on our day-to-day activities and work. Why is that a serious problem though?
Because vertigo or dizziness-like symptoms can cause people to fall down because they are losing balance. When you're not able to fixate your eyes, there's not enough gaze stability. People can fall down and hit their head on the floor and cause that could result in head injury and concussion, and that is pretty serious.
Definitely, that could be very serious. But it seems that it's one of those things that people kind of just sort of throw names at without fully understanding. And there's a lot of causes of vertigo when you get down to it. Can vertigo be caused by stress?
Yes, vertigo could be caused by stress, and there are many reasons for somebody to develop vertigo. That is why a proper examination is very important. Sometimes, when people who have fever, could be causing infection, yes, they need to go see their medical doctor when they have fever and vertigo or dizziness-like symptoms. But there are other reasons. For example, there are like teeny crystals in your inner ear called calcium carbonate crystals. They could get dislodged in your vestibular system. That could cause somebody to be having vertigo symptoms, or even low blood pressure, sometimes low blood sugar. So there are many reasons. It's about having a proper examination is very important rather than trying to treat themselves.
So that's one set of issues that you have to challenge as you're interacting with patients suffering from vertigo. But when is vertigo a sign of a more serious problem?
Many times, problems of the brain. Could be a tumor there. It could be some even a stroke. Sometimes there's not enough blood supply going to your brain because of the blood vessels going to your brain, like your carotids and your vertebral arteries. When there is some blockage in those blood vessels, that could cause vertigo, and there are so many reasons which could be serious. So again, that's why an examination needs to be done by a healthcare professional, so that even if you come to a trained physical therapist like me, and also trained in homeopathy, I would do the examination, and if especially neurological examination, if I see issues of neurological problems, I'm going to refer you to a neurologist. But we also do some examinations called Epley's maneuver, or we also call it Halpern-Dix test and Rolls test, to find out whether it is caused by the crystals in your inner ear, resulting in vertigo. So it's all about performing proper physical exam.
you know, as you start digging into the physical exam and being more specific, obviously the homeopathy also begins to play more into your ability to take care of your patients.
Because there are many.
Oh, go ahead.
There are many remedies which could help with healing symptoms of vertigo in homeopathy. So as I said before, homeopathy is individualized treatment. So that's why proper history taking and collecting all the symptoms and comparing these symptoms and matching to the correct homeopathic remedy, that could also help with healing symptoms of vertigo. And we have research backup for homeopathy helping with vertigo and vertigo-like symptoms.
Outstanding. You know, as you start looking more deeply into the different types of vertigo, you eventually get to something that's very painful, migraine related vertigo. You know, and it's often treated with very harsh medications. Um, and some of those medications have extreme side effects. What remedies do you offer that address the problem without unleashing unexpected consequences?
Homeopathy has wonderful medications to help with vertigo caused by migraine or migraine vertigo. Also, in physical therapy, we know that the upper cervical spine, the upper cervical nerves, they supply to your head. And sometimes when these nerves are affected, it could be compression, it could be tightness of those muscles around that area, stiffness of the joints in the upper cervical spine. That could also cause migraine-like symptoms, headache and vertigo. We call it, the term is called cervicogenic dizziness because it's caused because of the upper cervical spine issues. Now, we need to look at migraine is something which has to be, which should last for more than a day, and it needs to have an aura. So when you don't have these symptoms, and especially photosensitivity, when these symptoms are not there, typically it could be a problem in your upper cervical spine, and that is causing migraine-like vertigo and migraine-like headaches and symptoms. And we call it cervicogenic headache. The upper cervical spine, those nerves, when they are impacted, when they are affected, that could cause headaches. Like, wow.
I see. I see. So, as you discuss some of these consequences that are at risk, um, let's stay on this subject of risk. Who is most at risk of vertigo?
Well, athletes who are in contact sports, right? They could butt their head, and that could cause concussion. And concussion can cause vertigo. So it's about, again, we have wonderful remedies in homeopathy to help heal head injuries and concussion-like symptoms and vertigo because of concussion. As well as the elderly, 65 plus, they are more prone for vertigo. The reason is as it told and discussed before, we have a vestibular apparatus in a ear. There are crystals in the inner ear, calcium carbonate crystals. They could dislodge and cause vertigo. We call it the term is called BPPV, benign paroxysmal positional vertigo. Also, seniors are the ones who are on a lot of medications, and we have research which says any person who's on more than 3 or 4 prescription medicines, they are at risk of having dizziness. You can see in those medications, they put a label, this may cause dizziness. So when people are dizzy, they are at a risk for losing balance and falling and resulting in head injury. So yes, seniors and contact sport athletes are at a high risk of developing vertigo.
You know, it's interesting that you talk about the seniors having that high risk because of some of the debilitation just that comes with age. But it seems that it's easy to pick on them in this particular medical environment. What are some of the things that seniors can do to become more aware of homeopathic type remedies if they're experienced vertigo?
Well, if it is something which is, as I said, medically or systemic related, low blood pressure can cause vertigo-like symptoms, dizziness. We call it hypotension. You need to go see your medical doctor and discuss with them about the medication you're taking. And as I said, there are so many reasons. Any issues of the brain can cause also vertigo. But again, it's all about proper history taking and physical examination. You could go to your physician who's trained in treating these vertigo-like symptoms, and you can come to a physical therapist who's trained in vestibular rehabilitation. All right,
Mhm.
and We perform the examination and to perform history taking the symptoms. If you suspect something very serious, we will refer you back to your physician. If we suspect it is a problem of the inner ear, the crystals are dislodged, we can treat you right away and help you heal that. So it's all about taking the responsibility and going and seeing a healthcare professional who is trained in it. That way, don't wait on it.
Yeah. I think that rehabilitation component is really important, particularly when you look at the population in the Redlands area, which you serve. There's a lot of diversity to it from an age perspective, but you can't divorce the fact that there are some seniors there that are going to need your services. They need to have the awareness that you're able to do it, a rehabilitative type of process without having to throw a lot of medications or pharmaceuticals at them. So it sounds like you have a particular position in terms of how you're able to both serve and maintain some of their physical integrity at the same time. When you think about the seniors that you've dealt with, do you find a common complaint that they like to bring to you that you're able to immediately help remedy as you start thinking about just serving them better?
Well, the easily treatable symptom is when they complain of room spinning episode. Room spinning is the BPPV, benign paroxysmal personal vertigo,
Mm-hmm.
where the crystals in the inner ear are dislodged. So we perform a maneuver called the police maneuver, where we actually help put those crystals back in where it needs to be, rather than in the semicircular canals in the inner ear. So that can be helped and treated, the day you come. It also depends upon how severe the condition is, how many of those crystals have dislodged, so you may need a follow-up visits to help get that treated better. So in my experience, I was able to help with these symptoms like almost about 90% in 1 to 3 visits. So yeah, as I said, it depends upon the intensity of those symptoms.
Outstanding, outstanding. So as we go back to the other side of the house, the physical therapy, how does physical therapy explicitly help with vertigo?
So we talked about the problems of the inner ear, the crystal dislodging, and also problems of gaze instability. So we have exercises, or we call it vestibular exercises, eye exercises. We teach to help improve the gaze stability. That way, the symptoms of imbalance and vertigo can be helped and actually treated with physical therapy. Also, the cervicogenic dizziness, the problem coming from the upper cervical spine, that can be also treated with physical therapy, and we can help treat cervicogenic dizziness and cervicogenic headache. Again, it's all about proper history taking the symptoms, and performing physical examination to differentiate what could be the cause. It could be the inner ear, it could be the upper cervical spine, it could be even the central nervous system. All right, so it's or it could be just pure balance issues. So yeah, that is how we evaluate and treat it.
Outstanding, outstanding. One of the things I think is particularly um, interesting that I wanted to point out is that during our podcast, during the pandemic, we're sitting here in two different parts of the Inland Empire having a conversation about how you're able to treat different patients, different lifestyles, different age groups, but overall, you're able to be very effective in managing the healthcare needs of your patients. And what I want to ask you is, you have the opportunity, or you have the ability to observe physical distancing with your patients through your phone and online consultation. Can you share a little bit about how online consultation works with some of your patients, particularly the ones we've described today?
Yeah, we have a telehealth conferencing ability via Better PT. You can go to our website, excelrehabandwellness.com, and click on appointment for physical therapy, and we can set up telehealth services. And we can perform the same for homeopathy as well. Video conferencing, and it's about taking the symptoms and matching the symptoms to the correct homeopathic remedy. And physical therapy is an essential service. And there are some patients who are younger and who are healthier. They are willing to walk into the clinic and get treated. So we have those options. We wear masks, and we actually ask our patients to give hand sanitizer to be sanitized and everything. We take all precautions. So we have different ways to help treat symptoms of vertigo and even problems with cervicogenic dizziness and headache. You can also call our number at 909-792-5050 to set up an appointment, and we'll go from there.
Very good. There you go. Again, we have Dr. James George of Excel Physical Therapy and Wellness. He's here. He's serving patients who are young, serving patients who are less young, or it's been a while since they were young. But what's most important is that he's a compassionate part of the healthcare provider system here in Redlands, serving the Inland Empire. And he's ready to reach out and answer your issues with regards to physical therapy, regards to homeopathy. And I think you will find him an incredibly effective and compassionate solution.
Thank you.
Dr. George, as always, good to visit. I can't wait to hear what the comments that you'll be receiving as a result of what you've shared in managing vertigo. It's a very serious problem, particularly with some of our elderly. But again, you provided great solutions, and hopefully patients will find you and make sure their individual needs are met.
Thank you.
Glenn W. Hunter, be safe. We look forward to talking to you again soon.